Matthew Perry, we're back again. How are you?
Hey, Brienne, I'm doing well, doing well. Um, Nothing to report on the San Diego weather today, at least. It's pretty, pretty much like probably everywhere else. But yeah, doing really well. Lots of big changes here at the company, and all for the better. And always love being on the podcast with you.
Awesome. Awesome. Well, it's always fun having you. I love our conversations that we get to have about whatever, anything and everything we choose to banter about.
The whole thing.
So let's dive in. I know before you hit record, you had some things that you wanted to talk about today, and we'll kind of see where this takes us on tangents and everything else like we tend to do. But let's dive into the topic at hand, which is we talk a lot about surgeries not being needed, that people tend to have these surgeries when other conservative methods can do the trick. But we both know that sometimes surgeries are necessary in some cases. So let's dive into that conversation today.
Yeah, yeah. It's been something that's been kind of on my mind for a while. We as physical therapists, love working with people and love, dispelling that whole thing when someone says they're so broken that they need a surgery. But yeah, sometimes, it is indicated, right? There's a lot of conditions, out there that, by the time they get to us, they're too far advanced in the condition, to treat it conservatively, right? Or by other means. So, it's something that we need to understand, right? We always talk about, no matter what on this podcast, that we do have limitations, right? We're not miracle workers by any means. We're not pretending to be. And with with the whole surgical thing, at the end of the day, surgeries do exist for a reason. Been doing them for I think thousands of years now. And I'm glad we're not hitting people over the head with mallets anymore to knock them out, but we've advanced.
We have advanced.
But yeah, the thing that comes to my mind is, that person who has that really advanced arthritis, right? We have the A word, arthritis. And there's there is a point of, kind of diminishing returns. How much pain is this person in, versus how much benefit, can they get from simply exercise, joint mobilizations, and all those kinds of things. And as I said before, it's just so important. I know you do as well as I do. That we do know our limitations as PTs, right? We can't cure everything, right?
Absolutely. Absolutely. And I, with, well, yeah, with that said, we can't cure everything. I think I still think it's a good place to start, especially when it is arthritis or, just like pain started, but like you have a scan that shows something, but, maybe by doing therapy, you can avoid surgery or worst case scenario, the stronger you go into surgery, the better outcomes you have. So why not do some things on the front end prior to that surgery?
Yeah, that's that whole aspect of quote unquote prehab. I love that that's becoming more of a buzzword and a term, because there are significant bodies of evidence that talk about, okay, we've established that you're going under the knife. Okay, that's done. That's going to happen in 2 months or something like that. But why don't we get stronger, get more functional? And like I said, the bodies of evidence support that. Typically you'll have a better outcome on the other end of that. So I mean, that doesn't mean we don't, because someone's going under surgery, that we don't have a place in the person's rehabilitation process. But it just looks different, right?
Mhm.
And so maybe we're working on the adjacent muscles, right? Working on total body strength, because I bet pretty much anything, that if someone's been in that significant pain where they're going into surgery, that, they probably haven't been moving a lot. And their body isn't physically fit, right?
Mhm.
So, weight loss is key, because, the lighter you are, the better the anesthesia takes, and, all those kind of things. I'm not an anesthesiologist, but that's been from my perspective. And and all of that, then you'll have that better outcome. And it's like, even if that outcome on the other end of it is a week better than it would have other been, wouldn't that be nice?
Oh, definitely.
Get
Definitely.
back to running a week earlier.
Definitely. And I think too, besides the just getting movement in, because there's definitely athletes that get hurt or that have like meniscus tears, rotator cuff tears, things come up that you and I both know a lot of these are due, yes, they can be due to trauma, but a lot of them are due to repetitive use, mechanical faults, that sort of thing. So even just working on those movement patterns prior to surgery so they come out so you can like get off to the races in the proper strengthening patterns when they're out.
Exactly. The muscle memory is already there, right? The brain body connection is already there. So I think that's just super important. And I know insurances get weird about things that are actually going to help people, but but yeah, it's our our it's funny when it makes me think about when someone's thinking about buying a new TV so they can watch football seasons coming up, all that kind of stuff. You know, they will spare no expense. Most people will. Get the 8K, 90-inch, 80-inch TV, all of that kind of stuff. But when it comes to our bodies, now things become too expensive, right?
Mhm.
And although insurance might not cover that prehab that we're talking about, wouldn't it be nice to make that investment in yourself to, again, make sure you have better outcomes?
Yeah, it's so fascinating when you dive into the healthcare side of things and insurance and what people are willing to pay for. Just because when you do compare it to the new TV or the new computer or the phone that you're holding in your hand that costs $1,500, or all the things they don't bat people don't bat an eye at most times because they're maybe needed, maybe not. But then when it comes to like $500 for a PRP inject, for PRP or for rehab or whatever, it's like they don't want to spend that money. It's just fascinating to me.
Yeah, it's an interesting mindset. I'd be interested to see if, maybe that's more of a American kind of custom, where in, maybe India they are more, apt to invest. Or maybe it's just our mindset of, that we know we can take a pill for everything, or, oh, I'm going under the knife anyways, who cares? That they'll fix me, the surgeon will fix me. And so, yeah, it's extremely fascinating. But you should always know that, your healthcare provider is not necessarily there to fix you, right? It's to give the person the greatest chance at success, and whether that is through physical therapy and offloading some structures to be able to move better, or going under the knife to free up that scar tissue, or to remove or repair that damaged structure. Ultimately it's up to you, and that rehab is going to happen whether you um, want it or not, especially if you're going under the knife.
Yes. Yes, it is, or at least it should. It's
Should, yeah.
fascinating. Like, I've known surgeons in the past who, like, after total hips, because typically people can get up and walk pretty fast after those, like, won't even send people to therapy afterwards, or won't, like, they'll have to ask for it. And it's just fascinating some thought processes that go through some surgeons, not all. Like, there's definitely a lot that just automatically refer to PT, but it's fascinating the thought process that goes through some of the surgeons' heads when it's like, I just cut into you. I just did major repairs, major things, but you're fine.
Yeah, go have fun.
What you want?
Yeah, I have a very personal experience with that. A few years ago, my mother got a total hip replacement, and as things were really far gone, I think it was an indicated surgery for sure, and she's doing really well now. But yeah, the doctor didn't recommend PT for her until I think it was 3 weeks out. And, I obviously didn't like that at all as PT. We always adhere to surgeons, protocols and procedures and stuff, but, that just didn't make sense. So, I ended up flying up to see her, and I was with her day one, day two. So she had surgery on like a Wednesday, and I saw her on Thursday. And by like Friday, we were walking upstairs. Friday or Saturday, we were walking upstairs and doing stuff. And I think that's what expedited her outcomes. I don't want to say I'm a miracle worker or anything, but I think that quick rehab process got her doing that. Otherwise, she'd be laid up for 2 weeks, and whatever strength she did even have in the beginning, which was not much before the surgery, would be even more regressed. And yeah, that just doesn't make sense to me.
Mm, so weird.
So some conditions, right? Shoulder surgeries and things like that. Yes, we know we need to protect it for a little bit, but some of these other structures, it's like if you're not standing day one, we're not doing it right.
Yeah, absolutely. Absolutely. So tell me about surgeries that are indicated. How does someone know whether they should get the surgery or not? Because they talk to most surgeons are going to are they're a surgeon. That's what they do. They're going to say yes, you need surgery. Physical therapists on the other side of things are a lot of times like, let's just try to rehab this thing. How does the injured person, the person in pain, really like get a good understanding of what's best for them?
Yeah, yeah, that is tough, right? Because the surgeon wants to cut, the carpenter wants to carve, the PT wants to rehab, and all of that kind of stuff. And yeah, it can be very conflicting, right? Oh well, like this person says no, don't do the PT, or just do this. This other person's saying the exact opposite. I think at the end of the day, you have to listen to your body. I think we all have our trust should be trusting our gut in a lot of ways. Hear everyone out, you know, um, because all of these conflicting opinions, at the end of the day, we're not the person. The person does end up, knowing what's best. But hierarchy wise, right? If we're going to kind of go top down, you know, um, how about we quote unquote fail the conservative, fail the acupuncture if that's something, you're into, and the chiropractor and the PT, fail all those things, most of those things don't break the bank. And if you're still in excruciating pain, no change, or it's worse, now you can go to the cut, because you can't ever uncut. you can always
Very true.
you can always recover from some muscle pain or whatever, but yeah, we know surgery is kind of a irreversible thing that has other side effects too, right? It's not perfect.
Hmm.
Even the most skilled surgeons in the world, there's side effects to it.
Yeah. I think it's something it's really funny actually, because typically surgeons will go over, what the side effects, precautions, possible things that can go wrong, whatever. And when I had my ankle surgery from my bad sprain, this was back in 2004. And I don't know if it was because he knew I was in PT school, so I kind of knew a little bit of the medical side of things, but I was looking at the op report afterwards and he was like, "This is all explained." Or whatever, myself, no, it wasn't. I mean, I knew going into it like what the risks were, but at the same time, like, I don't think any of this was explained to me.
Oh, wow. And that's tough. You never want that kind of information after the fact, right? Yeah, that's just such a just disconnect in the healthcare system. Because I mean, a lot of my patients who I've seen post-op, they made it that it was almost sold to them, the surgery, as if it was essentially McDonald's. You go through the drive-through, order what you want, and you're out in no time, right? And then they realize very quickly that that's not the actual case. And so, yeah, I think there should be so much more education before someone's going into it. And it's not to dissuade, it's just we've elected to do this, and this is the good, bad, the happy, and sad of
Yeah.
it. Yeah. So,
Let's kind of dive into that because that kind of parallels the question I was going to bring up next, or the conversation I wanted to have next, which is, a lot of people with, and I see it a lot of times, especially with meniscus tears, rotator cuff issues, shoulder stuff. They just like, I'm just going to go have surgery because I just want that quick fix. It'll be better. And then I'll be back to doing everything again. Like, why is let's talk about that. Like, why is surgery not necessarily that quick fix that someone thinks it is?
mm. Yeah, that's a tough one, and that's those expectations, right? Because we're just sold this bill of goods, whether it be an Advil commercial or whatever, that hey, you got pain, just take this and take it away. And also, as I said before, just that lack of education on the health. I'm not blaming the surgeons, but the healthcare profession, as a whole. Um, and because I think a lot more people would explore that conservative stuff if they understood that, hey, if you got a total knee replacement, this is going to be a longer recovery, several months. It's going to hurt a lot when you're in the rehab process as we get the knee to move. And yeah, and after that, you're still going to need strengthening, and so, someone's expectation is, okay, in a week I'll be better after the surgery. And that's just simply not the case. And so, I'm kind of, it's funny you brought that up. We're toying with, here at the company, maybe, to provide that education, maybe we have a class for people who are expecting to go into whatever specific surgery. We be that vehicle of education as opposed to relying on a PowerPoint show or a 3D nicely rendered kind of cartoon image of, just drill it, and then we replace this and then you're good to go, right?
Yeah, definitely. As a guy from my gym, he's had issues on and off for years, and he was one like most people. They kind of just trained through it for a while, and he got to the point, it's like, I can't continue this way. Ended up having surgery, had some major tears in there, like one of those situations where surgery is indicated. But I saw him the other day. He's 3 months out, I think. And he's like, word of advice, never have shoulder surgery. He's like, it's awful. He's like, goes, the surgery itself is fine. He goes to the recovery process and the rehab. He's like, it's awful. I was like, yes. Yes, it is. The things they don't tell you.
Yeah, exactly. The things they don't tell you. I know. You should write a testimonial. Yeah. So and that's really an us thing, and I don't necessarily mean like me and you. I just again mean the healthcare system at large. Because that's very detrimental to all the clients, right? And it's like, okay, maybe 20% of the people who have the shoulder surgery walk out, no problems, good to go. I doubt it for the shoulder, but let's say that's the case, right? But then you still have 80% where that's not the case. So why are we catering to the 20? You know, let's say it's going to take 4 months, and maybe it only takes one. I don't think there's ever going to be somebody upset about that. Southwest Airlines, when they say it'll take 2 hours to get somewhere and you get somewhere in an hour, I don't think anyone's upset.
Right. So true.
Yeah, so it's a managing of expectations, which is and so yeah, I don't know a solution to it because I don't even think the hospital classes and stuff from my patients' perceptions, do a great job at managing those expectations.
They don't. And I think, thinking about some of the less aggressive surgeries, like especially, and I keep bringing up meniscus just because I feel like it's one that's very much overdone. That doesn't need to be done often, but at times it is. Um, but it's like you just hear conversations with people or you see it on social media or different forums, and it's like people just expect to be back to running in a couple weeks after, and it's like all of a sudden they're 3 4 months out and not running yet, and they don't really understand why. And I think you're right, we don't set the expectations properly as a health profession in or just as medical professionals in general on what that recovery process, the realistic recovery process. Because yeah, some people do recover really great and are back to running in 2 weeks or are back to doing stuff with their shoulder in 3 months, but that's not the majority.
Definitely not the majority. And the other thing is it looks, and this isn't taking anything away from a surgery because it's very complex, but especially meniscus surgeries look so simple, right? Drill a hole here, camera goes in, and then they'll shave us a little bit of stuff, so you're up, good to go, in and out. And yes, that's true. Maybe it is a less complex surgery than open heart surgery or something like that, but that's still a lot of trauma to the body.
Mm-hmm.
Your body goes to sleep under anesthesia in a certain situation, and then your body wakes up and it's like, oh my gosh, there was all this stuff that just happened, and so your body reacts to that, just like any other trauma.
Random or something that came to mind recently or just now when you were talking is, so most surgeries now are done orthoscopically where there's not very big incisions. Like every once in a while we'll have surgeries where they have big incisions, but for the most part they aren't now. Thinking back to say ACLs when I was in high school, it was the big incision on the entire knee, like you knew you had a major surgery. How much do you think that impacts people's thought process on how fast they'll recover when all they see are 2 or 3 little holes on them rather than a big incision?
Wow, I had never considered that before. And no, I mean that's a great point. Because yeah, if it looks like some stuff was done, then that automatically I would think, you go in your head, okay, so this is a big thing. I gotta take some time on this. But yeah, these just like kind of little holes and like two butterfly bandages on it. It just doesn't look like much. That's that's fascinating. Wow. I would say that has a huge impact, right? Or the other minimally invasive stuff where it's just essentially kind of lasers, going into you.
Mhm.
Wow. Um, and I'm sure the outcomes are much better, and recovery time is shortened, but it's not cut in half.
Mm-mm, not at all. ACLs are
Dang.
still a year, like
Yeah.
still have your healing process.
Wow. So yeah, there's that psychological component.
Yeah. So maybe we just need
Huh.
to start cutting into people like bigger.
Yeah.
Maybe that's all
Yeah.
the problem.
Bring back the 12-inch scars. Oh my. Yeah, that's something I'd love to probe some of our surgeons who we've worked with in the past and see if we could have them on and have a conversation about that. I think it'd be a
Yeah.
lot of fun.
It'd be an interesting conversation to have.
Yeah,
Especially some who've
yeah,
been around for a long time and have gone from the like incisions to, so I mean at this point now, because I'm thinking like they would have had been surgeons at this point for 20 some years. So some of them that are on the older side, but it'd be interesting to find out.
yeah, yeah. And even the question about, now I'm really getting jazzed about this. The because back in the day they didn't used to do PT right after surgery, right? There was not, it's like, oh, just rest it, and then we'll whatever, and things would get stiff, and all of that. We realized day one, if you have start having the rehab process, things get better. And so just seeing that whole evolution, right? Wow.
So
Sorry, everyone. This is in real time. This is not scripted. I'm actually having a profound moment.
making you think today.
Making me think. I need that. Um, so yeah, you know, regardless, we need to, much better manage people's expectations and stuff like that because, um, most of the people who come to us, are like, Matthew, I thought this was going to be like 2 weeks, and now they're finding out it's going to be months, and so now they got to cancel their trip, right? Because they,
Mhm.
they they thought they were going to be taking a trip in a month, when in reality that is not even kind of the case. Like you
Yeah.
said, for a couple people, one or two. Oh, um, but yeah, the onus is on everybody for sure. In that, but I mean, like, yeah, where do we start on that?
Yeah. It's interesting. Interesting.
Uh,
So getting back, I think it's a hard question to answer, but kind of getting back to like when is surgery indicated in that question? Because there's there's sometimes you'll see like knee stuff that will need it, sometimes not, sometimes shoulders that will need, sometimes not. And so it's like there's no clear cut answer as far as, when someone needs surgery and when someone doesn't. But is there any way that we can start giving someone a little bit of direction to like, if X, Y, and Z are there, like maybe consider these options type thing?
Yeah, yeah, you're right. It is very, complex, but I mean, I always go back to like, is it affecting your life? Is X affecting your life? And if so, how much? Is it cutting your run time or your run distances from, you know, 40 miles in a week to like 39 miles? That in that case, we've only cut out 1 mile because of some discomfort. No, I don't think you should be going into surgery for that. Obviously, unless you're a high performing professional runner or something like that, right? That's a big deal. But for most of us, no, that's not dramatically affecting our lives, and that's something you could probably fix conservatively, or get help with conservatively. But you know, are you now not able to walk your dog or run with your dog around the block? When that's something you've done for most of your life.
Mhm.
I think now we're probably talking about um, you know, something a little bit more than the conservative treatment? Or would you used to do the 40 miles and now you can't walk your dog around the block? I think that's a very abstract, but a good place to start, right? I want to know your thoughts on it though.
Yeah, it is tough, and I think it does depend a lot on the person and how much their function is declined. But at the same, I think that conservatives route is always most beneficial to do first to see. Because like you said earlier, like I think, try PT, try chiro, try acupuncture, whatever method that is for you, fail out of those first. Because if you can do that and recover, then awesome. If you can't, then at least you tried. And, now surgery's indicated. And, sometimes the scans will show that you need to. Have had two different family members at times that like show me their scans. I'm like, I don't think you're getting out of surgery on this one. Like, and both
For
of them
sure.
ended up having surgery after therapy failed. Um, so there are times that the scans just do look that bad. That's like try therapy, see what happens, but most likely are still going to need surgery. But yeah, I think personally, I say for the most part, obviously, there's going to be some cases where it's just like traumatic injury needs surgery, no questions about it. But I think a lot of times, yeah, fail the other things first and see.
Yeah. And so maybe it's a combination of that kind of pain, not that we always follow the pain, mixed with function. And so we'll call it maybe total disablement, for that person of,
Yeah.
and yeah, maybe there should or could be a scale, where they're at an 8 out of 10 of whatever disability they are. Not disability as like far as workers comp and work, but you know what I mean, life disability.
Hmm.
Then maybe that's a good time for them to explore those other options. But you know, in the same token, like you know, I know you get it too. You know, I had a client. You know, she came in for some shoulder issues. You know, just very stiff shoulder, rotator cuff issues, things like that. And their doctor thought it was coming from their neck, their medical doctor. And I think some of it was, but they instead of x-raying the shoulder and getting more information on the shoulder, which was getting better, they x-rayed their neck. And wow, they found everything, anything and everything that could be found was found in this person's neck. Mind you, again, their shoulder is getting better. They have never had or complained of neck pain, and now their medical doctor wants them to go under the knife and get surgery for their neck. And so that's the other side of this. And you know, I don't have a crystal ball. I don't know if they might have some problems later on in life, but you know, everything else that they complained about or had issues with got better.
Hmm.
You know, so now we're kind of stoking some of the psychological stuff and things like that. So it's so complex.
Yeah, and the getting better, getting worse is a huge one too, I think, because um, we both had those ones that's like things are improving, so probably surgery's not needed. But I'm sure we've both also had those ones. I know I have that's like, all right, we're doing therapy, and all of a sudden things are continuing to get worse, and like now they can't function at all, and so it's like, all right, like go get more tests done.
There you go. Yep. Refer out, as we say. Yeah. So, you know, again, this goes back to, you know, what I was saying before. It's like what we were saying before, you know, kind of like let your body be your guide with it. You know, your body knows if there's improvement and if there's not improvement,
Hmm.
right? You know, I think, you know, I'm young, but like, you know, like over the years, you know, I feel like we've kind of lost some of that body
Hmm.
intuitiveness and body, you know, awareness, right? We're now relying on external factors, and we should, right? These surgeons have gone to school for, you know, 8, 9+ years, you know, for this stuff. You know, we've gone to school for a long time with this stuff. Definitely take what we say into account, but you know, listen to your body at the same time. That should maybe hold equal weight to all the other stuff.
Hmm. No, I think that's a good point. I think it is something that's been lost, whether it's someone just not truly understanding what they're feeling, or, how often do we now just ignore the fact that we have pain in order to still train, still compete, still function in life. And, I think, or we just mask the pain with medications and things. So I think there is a lot to be said there as far as that we have forgotten how to listen to our bodies and notice what we're feeling. And
Yeah, you know, it's like sometimes I think it is healthy to take a good inventory, you know, in absence of the drugs, in absence of the other things, and just sit with yourself for some time and be like, okay, what am I really feeling? You know, what is this? And you know, sit with the pain, right? You know, that's not healthy on a daily basis or a you know, year over year. I'll drive someone crazy, but to take that moment, right? Just like you would meditate, just like you would think about your grocery list, you know, do that to your body or for
Mhm.
your body.
Yeah, that's a great point there. So I'm saying there's something that came to mind. I lost it. It's gone. I had a thought, but it's
Yeah,
gone.
and well, you know, while you're thinking about it, you know, and you know, that's something I think surgeons should be saying as well. Not I'm this higher power, and you need to do this, you know, and if you don't do this, your life's going to be miserable. Like, well, you know, that person is a tool, you know, just like
Mhm.
we're tools to to help that person make that informed decision. Because there's consequences for everything, as I said before. There's pros and there's cons for everything we do.
Yes. Oh, that brings up a thought. Something I was gonna transition to earlier and then didn't. When we're talking about all surgeries do have side effects, do have things that can happen. Obviously, we all know the like you could die under anesthesia and all that bad stuff, but not talking about the bad stuff, all the really bad stuff. Like what other things are can happen with surgeries as far as not that we might not be thinking about.
Yeah, I think the biggest thing and why I love the minimally invasive surgeries, because I think we're getting away from it, is, you know, typically when we're doing surgery, we'll talk about the hip or have done in the past with the hip. We've cut through a lot of muscles, which means we're cutting through a lot of nerves as well. And we're kind of stitching it back up and wrapping it back up and hoping that's going to function just like your other side again once it heals. And for some people, it absolutely does. From my experience with most people, it doesn't. And as far as consequences to surgeries, which I think was your question, right? Or other things that we should think about, that glute and those hip muscles, just they won't be the same after. And I'm not saying they'll be 0%, like the other side, but even that 90% of the other side, is going to have some implications later on. So we really need to be aware of that. In my head, I think it's one of the bigger things.
That and then the range of motion too. Like, yes, there are some people that get full range of motion back in the whatever joint has surgery, but there's most often some limited range of motion afterwards. That same thing. There's implications for movement later on.
Yeah, and that might be 10 degrees, but that's 10 degrees that you have on the other side that might have implications later on, or even just less catastrophic stuff, the clicking and popping and the fact that you can feel it at that last little bit of range too. And maybe having some assumptions that wouldn't happen.
Yeah.
Which can be distressing, right? No one likes things clicking and popping. I know that most likely, it's not tied to any huge pathological issue for me, but when my shoulder clicks and pops, I'm like, should I be doing this?
Right?
We all do, right?
I guess it's fine. It doesn't hurt. I think we're okay.
I think we're okay.
Another thing to think of too is, how many times do people get surgery and then they still have their pain? That it didn't actually fix whatever the problem was.
That's the really, really tough one. I'd say the toughest one. And hey, at the end of the day, it's a gamble. You have a pretty high percentage chance of coming out on the other side of it well. But there's no miracle cures, and if there was, we'd all be doing it. Right?
So true. Awesome.
Yeah.
Anything else that you want to bring up today?
Oh man, I always got things and stuff in my mind. That was another thing I'm going to really reflect on is the people who go under the knife and they're exactly where they are, or possibly worse, right? It's that's a tough one, if you have someone say they went in, they had some 5 out of 10 knee pain, went under the knife, came out, now their say meniscus, now it's a 8 out of 10. What's your typical, kind of way of approaching that? I know it's so different based off the person, but
Talking as far as the pain increasing?
Or we'll even say maybe no change.
Or no change. Yeah, obviously immediately after surgery, it's hard to get a good gauge on it. But when we're talking 3, 4, or 5 weeks out, there's no change. I'm someone who's pretty direct with them, assuming I know they can handle it. and
That's
just like, obviously you don't want to badmouth the surgeon by any means, but at the same time, like, you have to have that honest conversation that where they did the surgery was probably not what was causing the pain, and like having that deeper dive of movement of, you know, what else could have been contributing to it, what else could still be contributing to it, and how, best route to go about that. But it's a tough conversation to have.
Yeah, yeah. Particularly again with the managing of expectations that, oh, you're gonna be good on the other side of this, and all of that. Because that's a huge contrast to what they were likely thinking.
Mhm.
Yeah, that's where we kind of take, on our end, we'll take a little bit more of a, you know, behavioral kind of, approach and, trying to do things to dampen that. We've talked about the sympathetic, parasympathetic nervous system to kind of dampen that sympathetic response because that's distressing. Um, you went through all the time, effort, for that surgery. And yeah, maybe there's, something else going on, right? That was just missed. Maybe they have a meniscus problem, but they also have some things going on in their low back.
Mhm.
And everyone just zoomed right to that knee,
Yeah.
their medical professionals and never thought adjacent, right?
Yeah. And I think that's happens more, I should say more often than not, but it happens often. You know, there's I've talked to a lot of people, and I'm sure you have too, that it's like all they've looked at was that joint, not above, not below, not the back. And how many times are knee issues, foot issues caused by something in the back?
Yeah, frequently.
Yeah.
And I'm sure in your practice as well as mine, we frequently get people who have, explored the other conservative approaches, other PTs, big box PT, and that kind of stuff, and just wasn't working for them. And so, luckily, we have that information that everyone's been tunneling in on the knee. It's like, okay, well, let's look. I mean, you and I do it anyways, but it's like, yeah, okay, let's look above and below,
Yeah.
see what else is going on, and then we can get to the bottom. But we have that information coming into it that
Hmm.
they've exhausted the knee.
I think too, though, it's just being able to listen and assess what they're saying. Because I had one recently who displayed as plantar fascia, Achilles stuff, and but talking with him, he was like, you know, well, is there a time that's worse? No, not necessarily. Sometimes it's just when I'm sitting or lying down, or like, you don't have foot stuff or Achilles and plantar fascia stuff sitting and lying down. Like,
Mm-mm.
did I check the foot? Was there some foot and ankle stuff going on? Yes, but we also assessed the back and figured out what was going on there too. So I think sometimes too, it's just taking and like better subjective assessment, really figuring out when does someone have pain. Like if you can't reproduce it, or if they're having pain at times that they shouldn't be, if it was like a knee or a joint, a joint issue, then somewhere else has to be looked at.
Somewhere else always has to be looked at. I love that, and that's we have the ability, right? We're able to spend the time with someone, and I'm a proponent that someone's typically going to tell me what's going on with them, and it might not be that, oh, I have like some lumbar spine radiculopathy at L4 L5. They're not going to say those big words, but they are going to say exactly what you said. That very inconsistent for a typical foot problem, exclusive foot problem.
Mhm.
So yeah, we just have to, the whole health profession could spend a little bit less time talking and a little bit more time listening.
Absolutely.
We'd be a lot farther.
So true. So true. That might be a good spot to end this on. I think that's a good spot
Yeah,
to end this on.
yeah, absolutely.
So, Matthew, if anyone wants to find you, talk to you, yell at you, where can they find you?
All of those things.
In that
You
order.
could, yeah, in order. You can always find us. My company is AutoNest Physical Therapy, committed to your autonomy, happiness, and wellness. We're on all social media channels, and yeah, I'm still open to anyone who's listening and has agrees with what the things we're saying, maybe disagrees with some of the things we're saying. Let's have a healthy conversation about it, right? And let's come from a place of knowledge and understanding that we don't all know everything. We all have our skill set, and knowledge base, and talk about it, chop it out.
Awesome. Well, thanks again for joining. This was fun as usual.
Always, always. Thank you so much for having me on, Brian.
You're welcome.